Hi there, my name is Vlad. I'm a practicing physician and a co-founder of White Coat Locums, a staffing agency specializing in high-paying locum tenens jobs. If you're a physician assistant curious about locum tenens, the following conversation is for you. Caroline is an experienced physician assistant who is going to share what it's really like to work full-time locums. We discuss how she finds assignments, why she loves rural medicine, the skills PAs need to succeed, expected pay rates, negotiation strategies, and the lessons she wishes she had known when she started. Alright, let's get straight into it.
My name's Caroline. I grew up in Tennessee. That's where I went to university as well. And while I was there, that was the first time I ever left the country and traveled. And I did a study abroad program for 5 months. And that's when I realized just how much I love to travel. But I didn't know how I could really incorporate that into any kind of job. But I definitely fell in love with it at that time. Then I went to East Carolina University for PA school. And shortly after that, I moved to Rochester, Minnesota to work at the Mayo Clinic for about a year in inpatient psychiatry. When I was there, I again loved moving to a new place, experiencing a new culture, trying new foods. I'm experiencing extreme cold for the first time, which I never done before, and really enjoyed myself there. But I found myself kind of getting restless after about a year of being there and wanting to change. I then moved back to Nashville, where I worked as an inpatient hospitalist for a little bit of time in internal medicine, and then also switched over to family medicine. And it was during my family medicine job when COVID hit. I was working at this small clinic, and my boss let me know they probably wouldn't be able to pay me for the month of April because there was such a low amount of patients coming in during the start of the pandemic. So I seized that moment to go to New York City, and I worked at one of the COVID field hospitals there. And during that, I was like, I'm getting paid to travel and do medicine. And I realized this is it. This is what I want to do. So I came back after that assignment. I applied for a few state licenses. And then as a couple of those started trickling in, I let my boss know that I was going to quit to do full-time locum tenens. I put in my notice, and then I started doing full-time locum tenens work.
Great. Caroline, can you tell us how you find locums jobs?
There's a few ways that you can approach it. One, you can start with, where do you want to go? So if you have a desire to go to somewhere like Alaska, then you can start with getting an Alaska license, wait for that to come in, and then you can start searching Alaska physician assistant locum tenens work. And you can pick and choose assignments that you'd be interested in, contact the recruiter. Google's really great for that. They have a lot of job postings you can see easily in a Google search. And that's one way that you can find a specific assignment. Another way is just through word of mouth and social media. I found that the majority of my assignments have actually been through social media or through just talking to doctors or PAs that I've met while on assignment. For example, this past summer, I got to spend the entire summer in this beautiful town in Maine. And it all started just from listening to a podcast where I heard a doctor talk about how great his summer in Maine was, how much he loved practicing medicine there. Then while I was on an assignment, I met another doctor who had gone to Maine, said she absolutely loved it. I applied for the Maine license. I got the license about a month later. Then I went to Facebook and I searched for Maine in a couple of Facebook pages for APPs that will post locums jobs. That I found immediately a post. It had an email. I contacted them. 5 minutes later, I got a phone call from the medical director whose email was provided. I ended up talking with them on the phone about the assignment for about 15 minutes, was offered the position. I did 3 months of credentialing, and then I spent the whole summer in Maine, and it was one of my favorite assignments I've ever done.
Do you prefer working with hospitals directly or with agencies?
I've had a couple of experiences with both direct and with agencies. My experience with a direct assignment was in New York City. I was actually on an agency assignment, and then the agency ended up closing down, and I stayed on direct with the hospital as a per diem PA hospitalist. They did agree to cover my housing for a period of time and started paying me as a W-2 direct employee. But over a few months period, the housing contract fell off. And if I wanted to continue to stay, I was going to have to cover my own housing, which did not make sense at the time. I've also had that direct assignment, like the example I gave for Maine, where it did give me the specific town that I wanted to go to in the specific state. So the pay was a little bit less, but it did allow for me to go exactly where I wanted to go. I think that there is some more money that can be had with doing agency work, but there is some more strings attached with that. The agency work, it will just require you keeping up more with your expenses and your reimbursement that they would be doing for you. You also don't have the freedom to just easily book your own flight, book your own hotel, which is something I do enjoy with a direct because it's just all my own arrangements. With the agency, they are going to do that for you because they're taking care of those reimbursements, or they're going to be the ones you're sending your receipts to. So I think because of them reimbursing your expenses, it makes it a little more complex, but it also allows for you to make more money. I would say also, if a facility has the money to pay an agency to help contracts, that facility is going to have more money and thus an opportunity to make more money. These direct assignments that I've done have been in these small towns, these more rural facilities, which do not have as much money to give, but they are, in my opinion, a more interesting and fulfilling assignment.
Can you tell us why you love rural assignments?
So this last year, I've been focusing almost exclusively on rural assignments. I got my first taste of one about a year ago, and I just fell in love with it. It's just this part of America that you truly never see. And you get to meet people that you would never normally meet, and you experience this very close knit culture that's not as tainted by the surroundings. And so it's like this culture that's been this certain way for hundreds of years. You meet people who have never left the town while you're there. And it's a very grateful community because it is hard for them to get medical providers there. The patients who do see you are always so grateful for the time and thank you for taking care of them, which is something that is lost, I would say, in the big cities. So it has more fulfilled my desire of, so doing these assignments has allowed for me to find that love of medicine again and really get back connected with the patients. Because it's a smaller facility, it also allows for you more time with each patient. Whereas in a big city, I find myself going from patient to patient and not having time to talk to them and really get to know them better, which is one of my favorite parts of working in healthcare. So these small facilities, I think, are excellent for people that want to focus on patient care, communication with patient. For example, I was working in a small rural hospital in Washington, and the whole morning, not one person came into the emergency department. And then after 5 hours of being there, somebody came in and it was a stroke. And it was so nice actually focusing on just one patient that was having a stroke. I was able to give excellent care. I feel like we were able to get the TPA going so quickly, get on the phone with neurology, and quickly able to airlift them to the next facility. And I find that when a stroke patient comes in and I'm in a big city hospital, the anxiety is much higher because I realize I have 5, 6 other patients that I'm managing at the same time. So working in these rural facilities, you still see very sick patients, but you're able to more easily focus on them and give them the care that a high acuity patient deserves.
What do you think about the demand for locum tenens PAs?
When I first started with locum tenens, I wasn't so worried about demand because of the COVID-19 pandemic. And I just found that first assignment so easily because New York City was just desperate for providers to come. Though I did realize once I came back that I was starting to get worried about if I do transition to this full time, what if there is going to be enough work for me? Because of that, I did go ahead and start getting multiple state licenses because I saw just by searching for Tennessee and locum tenens, I wasn't getting too many hits, especially for Tennessee locum tenens TA hospitalist. It was a very specific niche. So when I realized that I wasn't going to be able to do locum tenens within Tennessee, that's when I went ahead and applied for state licenses. I did my research and I found that there was some states that were very dependable for locum tenens work. So I got a license in California, Alaska, and Pennsylvania and New York State. But even then, I still had a lag time before I found an assignment. I had one set to go for New York City. I was going to start in November. And so I kept doing my family medicine assignment until the end of October. And they were able to fill my position when I gave them notice. So I knew that at the end of October, I was no longer going to have a position there. But then my assignment in New York got pushed back, and it got pushed back again. Eventually, I was able to find an assignment by January where I did start doing the full-time locum tenens work. But there was certainly that period of 2 months that I was not expecting. I did not expect my assignment to be pushed back. And I would say that was something I certainly learned from. Once I was in the mix, I found it was easier to find assignments once you're already in that mindset. You're already been talking to recruiters, and more assignments do seem to come. However, after a year, I did realize that my skill set was not as broad as it needed to be to ensure getting more assignments. I did continue to add on to my licenses, and I actually now have 11 state licenses. But during this time period, I realized that I was a hospitalist without any procedural skills. And I was finding that there was not as many opportunities as I would have liked, even with a lot of state licenses. So I actually made a decision to go back and work a full-time staff position in emergency medicine because I kept seeing a lot of emergency medicine jobs and a lot of urgent care jobs. And I knew I wanted to do locum tenens for the rest of my career. So I took a year away from locum tenens. I got that emergency medicine experience. And then I started traveling as both a hospitalist and an emergency medicine provider. With all those licenses, I've found that there is ample opportunities now. I think if you are flexible on where you're willing to go, especially into small towns or even also covering these really big cities that need extra ATP help, that you're going to be able to find an assignment if you have enough of those big state licenses and a broad enough skill set.
What are the skills needed to start working locums?
So for physician assistants, the difference between a PA and a physician is the vast difference in our training. A residency is much more predictable for a physician. And so when an agency is hiring a physician, they have a good idea of if they've completed an emergency medicine residency, they're going to have certain skill sets. But that's so different for the PA. So because of that, you have to be very sure that when you're speaking with an agency about what they're looking for, they will often ask you, are you a solo coverage PA or will you require MD backup? And it's important to be honest about what your skills are because a solo coverage PA, they're going to expect you to be able to intubate, to perform chest tubes, to maybe crike somebody. It's very advanced skills. And you'll especially find those in Alaska because it's such a large state. They do use PAs and have to have advanced skill sets in these rural parts of Alaska. And those assignments are going to be for a very specifically trained PA. For myself, I don't have those advanced skill sets. So when I'm looking for an assignment, they'll frequently ask me, are you comfortable with intubating? Are you comfortable with placing chest tubes? And I have to be honest and tell them I'm not. But I have found there is certainly a lot of demand for PAs to be used to help with all the extra patients in facilities where they'll have an emergency medicine doctor and there's just too many patients for the emergency medicine doctor to comfortably see, especially if they're managing more acute patients. So I found that a common spot for a PA in emergency medicine for locums is to go to these towns and serve as a backup for the doctor, where you're really seeing more of those ESI 3s and 4s, which allows for the physician to focus on those high acuity patients.
How many years of experience is required to start with locum tenens?
When I was doing hospitalist locum tenens, I found that there was more of this 2-year phrase that I heard frequently. They were wanting 2 years of experience. But I believe that as time has gone on and as we're living in this post-pandemic medical world and there's just more patients than there used to be, I do believe that there has been a little bit of a lowering of these standards to the detriment or not. But I do believe that it's just mainly important to let them know what your skill sets are. And when you speak with the medical director of a facility before you go on, be honest with what your skills are. And if they're okay with that, they'll take it. I believe that this change of this 2 years has been something that's been hotly debated, at least in some APP groups. I frequently have seen people saying that they're wanting to start locum tenens work, but they've only been working for 1 year. Do they recommend that they stay 1 more year at their assignment, or should they start to travel? And I think it's just going to be so dependent on where you are. I think if you're going to be paired with an MD, like frequently as a hospitalist or as an emergency room, you're going to be seeing patients alongside a physician, and that physician is going to always be available for you to present. I think if you know your own limitations and you know when to ask questions and you're honest with them, that's where your skill set is. I think you could practice in a field of medicine with just 1 year of experience. Um, I've been doing this last year of emergency medicine, even though I only had 1 year as a staff emergency medicine provider. Now, before that, I did work for 5 years as a PA in hospitalist and family medicine. So I was able to grow on that skill set, but I make sure that I only take assignments where I am paired with an MD at all times, where I'm never going to be solo coverage. And I found that my skill set is perfectly fine. I let the MD know when I'm concerned about a patient, when I don't know exactly what to do. And in my experience, the doctor is always more than willing to help. And I always make sure I see those more low acuity patients that physicians oftentimes really do not enjoy being able to see. And with that teamwork, it allows them to focus on their high acuity patients and for me to focus on turning the patients in and out the door. When you're thinking about your amount of experience that you have, 1 year at one facility is not the same as 1 year of experience at another facility. My 1 year of emergency medicine, I was in a very high volume, high acuity emergency department, which allowed me a lot of experience and a lot of time to grow in my procedural skills and high acuity skills. If I had spent 1 year in a rural hospital where I only saw 4 to 6 patients a day, I would not have been at the skill set needed to start to travel after 1 year. So it's important to really analyze the facility you're currently at and determine if you are growing as a provider enough in that short period of time, or if you're going to need additional time because you're just not seeing that many patients.
How many patients you're expected to see?
A typical PA hospitalist on locum tenens assignment will see maybe between 8 to 10 patients a day and be paired with another physician. That's the experience that I have had so far. The patients were the same as what I saw on my training when I was initially working as a hospitalist, except maybe a little lower acuity because I was in more of a rural hospital setting in each time. I think that if you are more concerned about having a high enough skill set, that focusing on rural medicine is a good place to focus on, because rural medicine is not going to keep those high acuity patients inpatient. They will have to send all of those high acuity patients to tertiary care centers. So that does allow you to have a more manageable patient load because they are not as sick as would be at a larger city hospital. But it's fair to expect that a rural facility is going to have lower acuity inpatient and a large hospital will have high acuity inpatient census. As far as my emergency medicine assignments, those can range greatly. I've worked in the northern tip of Alaska where I have seen 2 patients a day in an emergency medicine. I was working kind of the subset area of the ER. They had the main ER where the MD was, and then they had a urgent care part of the ER where I saw patients, and very few people would come in because it's not a full town. But then I've also worked in suburban emergency departments where I could see up to 20 patients a day. So it's going to depend greatly on the location you are and what that typical patient load is. But basically, go by the size of the town, and that's what's to expect of how many patients a day you'll see.
What are the pros of locum tenens work?
One of the biggest pros I've seen with working as a travel PA is the financial incentives for it. There is certainly a higher hourly pay than what you can expect in most staff positions. There's also a financial gain with tax incentives because of converting myself to an LLC or an S Corp. That has allowed me to take advantages of taxes that I normally wouldn't have been able to do as a staff PA. And my effective tax rate is much lower than it was when I was working as a staff PA for a salary. Another advantage is the 100% schedule control. I not only like to travel for work, but I also love traveling to other countries and experiencing cultures there as well. And when I was working as a staff PA, I would have to wait for my time off to be approved before I could plan a trip. And there's not always a guarantee that I'm going to have that time off, and it delays your ability to book these trips. As a travel PA, I'm able to book my whatever trips I want to go on in advance, and then I just create my schedule. Another pro for me personally is I do enjoy experiencing new cultures and meeting new people, which is something that I'm able to get by going to all these different states. Not only are you experiencing new people, but you learn that medicine is practiced differently in each part of the country that you're in. You may be trained in one part of the country, learning that everybody has to have lactated ringer. That's the best. There's nothing better than lactated ringer. And you'll go to another part of the country where they're like, lactated ringer is the worst. Everybody needs rumble saline. And it's just interesting to see how medicine truly is an art and it's truly cultural. And that allows you to grow as a provider as well and learning all these different skill sets. I also really enjoy having variety in work. As I mentioned before, I can get very restless on being at the same assignment, the same job for a prolonged period of time. So the ability to move from place to place, you get to experience new staff, new management. So if you're at one assignment and someone's really bugging you and you're so frustrated you have to see that person so often, just know that assignment will end and you'll be able to go on to the next assignment. So it does allow for you to go to work more open-minded and knowing things can roll off your shoulder much more easily because you're not going to be having to deal with whatever drama that is for the rest of your career. It'll change as soon as you go to the next assignment.
What are the pitfalls of locum tenens?
So some of the frustrations that come with working as a locum tenens provider is just that extra element of having to manage your payroll, how you're going to do your salary, your retirement, your health insurance. There is a pretty steep learning curve for that. I think that over the last few years, I feel like I've tried to study so much about taxes. I've gone through a couple of accountants, just trying to find the best way to manage those things. Whereas if you're at a staff job, they're going to take care of your retirement for your health insurance, your benefits. So that is an extra step that you have to do as a locum tenens provider that you wouldn't have to do as a staff PA that can be extremely cumbersome. But I'll say now I've mostly got it figured out. And I would say that those tax savings I am having because of doing all this on my own, I do think it makes it better in the end. But that can be quite a headache and can be intimidating for people when they're first starting. I would say if that is something you're particularly worried about, you could consider doing agencies that are W-2 only that do provide benefits. I know some people who have done those W-2 only agencies and they just go from assignment to assignment and that agency takes care of all those things for you. And that could be a good solution for someone that's the only thing holding them back. But know that there is more money to be made if you do grin and bear it, stay 1099 and able to learn all of these things on your own. Another frustration can certainly be just staying on top of your pay. There's been multiple times where I've found that my pay is off. Either they paid me too much, they paid me too little, and then there starts the whole game of reaching out, letting them know where the pay discrepancies are. And so you do have to keep a good Excel sheet of your hours worked so that you're prepared to know what your income should be, and you'll be able to let them know when your income is off. That's certainly something you don't have to do when you're a full-time salary PA. Another thing that can be frustrating for people when they're first starting off is that variability in your pay, because you can find you get a surge of pay and then you take some time off and then the pay is not there. So really developing this technique of how to spend your money, how to distribute the money into your account so that you have reliable income is something that can take time to adjust to. But again, I do think that it's worth it because of the extra pay that you ultimately will make.
Can you talk to us about the pay rates?
Pay rates for PAs is largely dependent upon the specialty. Family medicine PA, there are a lot of need for family medicine PAs, but unfortunately, they tend to not pay very well. It's the lowest paying specialty, and it's one that you would really need to think through and see what additional skill sets you have. Perhaps maybe your family medicine experience, but that could transfer to urgent care because there's more money to be had for PAs in the urgent care setting. There's also certain specialties like vascular surgery PAs that is at the highest. At the pay rate, they're going to make the most pay because they're going to generate so much income for the hospital. So you really have to see what kind of income are you generating for the hospital of what you're going to expect for what pay that you can have and how valuable your skill set is and their requirements from you to be able to run their facility. I would say for an emergency medicine PA, a good goal to shoot for is between $100 and $110 an hour. Now, that will be dependent upon the amount of patients that you see. If you're at a rural hospital and you're only going to be seeing 4 patients in a 12-hour shift, don't expect to make 100 an hour in most cases because you're truly not generating that much income for the hospital if you're only seeing 4 patients a day. But at many of these rural facilities, you can still expect to see 16 patients in a day. And with that, you should be getting at least $100 an hour for your skill set, but could expect up to 110 or 120. I'd say the pay for a hospitalist PA is similar. Now, their locums does come in waves. Sometimes the hospitalist is more lucrative, and sometimes emergency medicine is more lucrative. And you have to be prepared to see that you're going to see those fluctuations in the pay rate. That, as far as my understanding, is also the same for physicians as well. There just seems to be shortages and times of feast or famine for each specialty, which is why it would be advantageous to have a couple of skill sets, especially as a PA, when you are more able to learn different skill sets to allow for you to accommodate during those different waves.
Tell us about W-2 versus 1099.
You can find both W-2 and 1099 assignments. For a 1099 assignment, you should expect to be getting at least about 15% more hourly because they are no longer paying your payroll taxes like they would for W-2. But you really have to do the math out to see if you're actually benefiting by doing a W-2. In my experience, there is truly more money to be made with 1099 because not only are they giving you a higher hourly rate, but you yourself can find bargains on your health insurance and other things like that. Whereas really they might be putting $1,000 towards your health insurance when you yourself could actually find something cheaper. So I think you should never take a 1099 pay that's less than $80 an hour because you can find plenty of W-2 assignments that are going to pay that. But in general, 1099, you should expect at least 15% more. Now, sometimes an assignment will give you the option. They'll say, hey, we can pay you W-2 or we can pay you 1099. I think that's an opportunity for you to really take advantage of that offer and ask for more. Because if they're giving you that offer, it's because that facility knows they're going to save money by having you be a 1099, and they're going to save more than you even realize. So you really should try to maximize that pay. Another way you can maximize pay is if you see a locum tenens assignment, but you actually live in that town, and therefore you won't be requiring housing, you won't be requiring travel. Sometimes they'll say, oh, hey, we're just going to cover your gas for you, and that'll be your travel, and we're going to pay you the same rate. You should not accept that. This facility is going to save so much money by having a locum provider. If it's with the local provider, not only are they more likely to keep you there, and they know that if you actually live locally, you're likely going to stay on longer and longer, but also they're not paying for your housing, for your hotel stay, with the knowledge that if somebody was coming from another state, they'd probably be paying for a full week in a hotel, a round trip, and they could be doing that 2 weeks out of the month.
How about the pay rates for high-demand specialties?
Cardiothoracic emergency PAs, I frequently see postings over $200 an hour. I think that's because it's such a lucrative assignment for the hospital because they're going to make a lot of money on those vascular surgeries. So having that skill set, you should not be accepting less than 200 an hour, because I frequently see it listed as high as that. Critical care PAs that do have advanced skills, such as ability to place central lines, chest tubes, those kind of things that could be done regularly in a critical care unit, those PA postings are often over 150 an hour. And so I do believe if you have that much of an advanced skill set, because the majority of PAs do not, but if you know that you have these critical care skills, you should easily be able to find assignments for $150 an hour.
What do you think you would do differently if you started again?
So if I could start from the beginning and redo my initial experience for starting the locum tenens, there's definitely 5 things that I would change. First, when I was first starting off, I signed up for multiple different locums agencies. I filled in all their paperwork. Gave them multiple references and got plugged in with multiple agencies at the same time. And I literally didn't use one of them. It was such a waste of time. My references were getting burned out because it was multiple times. They were getting emailed by different agencies. So if I could do that again, I would not sign up for multiple agencies. I would wait until an assignment came to me that I liked, go to a specific agency, look on what they have. If there's a specific assignment you want, then you can ask them about it, see if you'd be appropriate for it. They might even present you, and then you can sign on with the agency. You do not have to sign on with the agency before they present you for an assignment, in most cases. Another piece of advice I would give for somebody is to not overcommit yourself to one assignment. When you're first getting credentialed to an assignment, it's very possible that assignment's going to fall through for any reason. No fault of your own, but it could fall through. If you give an assignment, for example, 16 days, and you say, I can give 16 12-hour shifts to you for this month, then that precludes you from trying to get any other kind of assignment. So it's better to hedge your bets between 2 assignments. Say you can give 8 shifts a month. That allows, or even 6 shifts a month, and that would allow you to theoretically cover both assignments if they do both work out. You don't want to lie and tell them the wrong amount of shifts, but if you tell them each 6 shifts, you can certainly cover 6 shifts at 2 different facilities in a month. And that allows you to have a backup plan in case one of them falls through. Furthermore, if there's one that you really and you hate the other one, that allows you time to work both assignments, see which one you like, give a respectable notice, whatever it is they ask for the assignment you don't like as much, and then you can stay on and give additional shifts for the one you truly enjoy. Another advice that I would give for somebody is to look for assignments that have ongoing need. Sometimes you'll see assignments that are specifically for a maternity leave. And most of the times when that maternity leave is over, they're no longer going to need you. And credentialing is so time consuming, it can be really frustrating to come onto a position, only work a couple months, and then they'll never ever need you again. So I think it's better to focus on assignments that have ongoing needs, because that allows for you to continue to work there for a longer period of time. Better yet is to find an actual hospital system. For example, I've covered a hospital system that has 5 different campuses throughout a state. And because of that, I'm able to get credentialed within the system. And that automatically gives you 5 hospitals instead of 1. So I was working at one facility. They found a full-time PA while I was working there. And I was easily able to be transitioned to another facility that needed help without having to go through the whole credentialing process again. And you've already started to build rapport with that agency. And it looks good if they want to keep you and have you going on. And that also allows for them to be a good reference in the future for you if you've already built those relationships with them and have been on with them for a prolonged period of time. And my final piece of advice that I would give is before you leave an assignment, make sure that you get the phone number and email of a physician that either saw you do a difficult procedure, saw you manage a complex patient, or just one that you became friends with. That's going to help you keep your references up to date. I found when I was first starting that I was still using references from my staff job, and they were getting 8, 9 months old because I just hadn't gotten those connections from those assignments that I was doing. And so now I'm sure to focus in. If I get along with one of the doctors, build rapport with them, and before I leave the assignment, I get their phone number and email, and I ask them if they'd be happy to be a reference for me. That way you don't ever burn out one reference, but you keep them fresh for each assignment.
Any advice on getting higher rates?
As far as negotiations, there's always ways to make more money when you're on an assignment. If you're at a facility and they're using an agency to help find contractors to work, that means this facility is likely somewhat desperate for shift coverage. And they're going to ask you to pick up additional shifts. They might ask you to go to cover another facility. Lots of last minute opportunities to pick up shifts. And when I first started off, I would just say, yeah, sure, I'll pick up that shift. So let me do that for you. And then with time, I realized that I'm a valuable asset to this facility and I need to understand what my worth is to the facility and understand that I should be properly reimbursed for that. So over the last year, I've been more sure to ask for a bonus. If someone asks me, hey, would you mind coming in tomorrow? I know that's your day off, but we could really use somebody. Someone called out. I'll say, sure, I'll come in for $250, for $500 as an addition to my normal hourly rate. I have yet to be told no for this. Sometimes they'll say, we can't do 500, but we can do 250. And I'll say, okay, that works for me. Or they'll ask me to cover another facility that I wasn't planning on covering, which will require me to drive farther. I'll, of course, ask to be reimbursed for my time driving, as well as an additional bonus for that shift for covering a shift I wasn't planning to cover. So just know there's always more money to be had if you're willing to negotiate and just ask for a little bit of a bonus. Usually they're going to be willing to work with you in some capacity. Another way to make more money on assignment is to not accept a low rate. They'll frequently catch on if you're more green, and the recruiter might be less honest with you about what the rate really could be. One way that you can counter this is by asking a Facebook group or whatever social media you use, say, hey, I was just offered this rate in this town for this specialty. Do you think this is an appropriate amount of money to be had? And you'll oftentimes get feedback, and that will really allow for you to learn from others' experiences on whether or not you should take that rate. I will say women tend to be a little bit more at prey for this. And I do believe that women are more easily able to be negotiated at a lower rate. So as a female, you should be extra judicious about negotiating higher and asking your male colleagues on Facebook what they would accept. Another way to make sure that you're getting an appropriate rate is to not be desperate for money. What people do is they'll put their notice in for their job and they don't have reserves, and then their assignment that they're on falls through, and then they're forced to take a lower paying assignment. Recruiters can certainly understand when someone is more desperate for an assignment and they're going to lowball you. And you might have to take that lowballed rate because you don't have the appropriate reserves. So I would recommend having between 4 to 6 months of emergency funds before you start traveling so that you're not forced to take a lowball. So you're not forced to take a lowball gig, and that allows you to maximize your pay from the beginning. Because once you're at a specific pay for a facility, it's going to be harder to negotiate more money.